All right, well, welcome back, Emergency Medical Responder. This is Chapter 9, Patient Assessment. This is a very, very important chapter. This is what guides us down the pathway of being a good emergency medical responder. And one day, if you decide to move up in the ladder of emergency medicine, it'll lead into EMT, emergency medical technician, and maybe even paramedic. These are the stepping stones that we use in emergency medicine on assessing patients. So let's get started. We'll just do a little introduction here. Right, so EMRs are the first trained emergency medical services providers at many emergency scenes. Your assessment of the scene and patient will affect the level of care requested for the patient. It is very important that you're able to perform a systematic patient assessment to determine whether your patient has a medical condition or has sustained injuries from trauma. The patient assessment sequence consists of 5 steps. Perform a scene size-up. Perform a primary assessment. Obtain the patient's medical history. Perform a secondary assessment, and then perform a reassessment. This sequence allows you to systematically gather the information that you need. All right, so the skills and knowledge presented in this chapter follow an assessment-based care model. With an assessment-based care, the treatment rendered is based on the patient's symptoms. The assessment-based care requires you to conduct a careful and thorough evaluation of the patient so that you can provide appropriate care. All right, so let's get started. The patient assessment sequence. The patient assessment sequence provides a framework that you can safely approach in an emergency scene. Determine the need for additional help and examine the patient to determine injuries or illnesses that are present. You can also obtain the patient's medical history, report the results of your assessment to other personnel when they arrive. All right, so the scene size up. It is a general overview of the incident and its surroundings. So first off, it begins by reviewing the dispatch information. The dispatch information is the information that's provided to you by your dispatch system. It allows you to anticipate possible conditions by reviewing and understanding the dispatch information. Your dispatcher should have obtained the following information: location of the incident, main type or problem of the incident, okay, number of people involved, and any safety issues that are on scene. Other factors that can affect your actions could be the time of the day of the week, and then any persistent weather conditions. Think about the resources that may be needed and mentally prepare for other situations that you may find when you arrive on scene. If you should come across a medical emergency, notify the Emergency Medical Dispatch Center by using your two-way radio. If you do not have a two-way radio, use your cellular phone or send someone to call for help. All right, so scene safety. Big, important stuff is to make sure that your scene is safe and you've created a safe scene to work in. Put your vehicle so that it helps secure the scene and minimizes traffic blockage. Scan the scene to ensure that you're not putting yourself in danger and make the following determinations: the extent of the incident, possible number of people that have been injured, and then the presence of any possible hazards. And you're going to perform a scene size up. You're going to look at the overall situation. All right, so continuing on, that scene size up is going to include a lot of information. Hazards can be visible or invisible. Visible hazards include the scene of the crash, any fallen electrical wires, traffic, spilled gasoline, or unstable buildings or unstable vehicles, a crime scene, weather, crowds, okay, and then unstable surfaces such as slopes, ice, and water. Invisible hazards include the following: electricity that you can't see that's flowing somewhere or another, biological hazards, hazardous materials, and any poisonous fumes that may be in the air. Note the hazards and consider your ability to manage them and decide whether to call for assistance. Usually it is much better to call for assistance and allow for you and others to correctly handle the situation or the hazards at hand. Okay, if a scene is unsafe, keep people away until specially trained teams arrive. Identify any potential exit routes from the scene in the event the hazard becomes life-threatening, and wear appropriate personal protective equipment. All right, so determining MOI or NOI. MOI is mechanism of injury, and NOI is nature of illness. Look for the clues that may indicate how the accident happened. If you can determine the MOI or NOI, you can sometimes predict the patient's injuries. Ask the patient family members or the patient themselves, obviously, or bystanders, for any additional information that you can get. Do not rule out any injury without conducting a full body physical assessment of the patient. All right, so take standard precautions. What does this mean? It means utilizing gloves, it means utilizing, safety glasses, those kind of things. Before arriving at the scene, you need to prepare yourself by anticipating the types of standard precautions for infectious diseases that may be required. Always have gloves readily available. Consider whether the use of additional protection such as eye protection, gowns, or masks may be necessary. Wash your hands thoroughly after contact with the patient or contaminated materials. All right, so determine the number of patients. We are still in scene size up. Call for additional assistance if you think you will need help. If you don't have the resources to manage this, then obviously you're going to need some help. It may be necessary to sort patients into groups according to the severity of their injuries to determine which patients should be treated and transported first. Consider those additional resources. 1. Additional resources may include the following: law enforcement personnel for traffic control or crowd control, fire departments for units for spilled fuel, fire, or extrication, a utility company so that it can take care or mitigate the damaged utility lines, and then a wrecker operations for vehicle removal. Report that need for additional resources to dispatch at the same time you report the number of patients. All right, so let's get into primary assessment. So now we're talking about the assessment of the actual patient. We've gotten beyond the scene size up, so we're going to start working now. We know the scene has been sized up. We know that it's safe. We've gotten all the information that we need to the people that we need to get it to. Now we're going to talk about the actual patient assessment. The purpose of the primary assessment is to identify life threats. So let's highlight that. So it's to identify life threats. The first thing that happens is you form a general impression. And no matter what level of class that you're in, whether it's our EMR class or whether it's our paramedic class or our EMT class, this is what we hammer every single time that we talk about this particular subject. That formation of a general impression is the very first thing that you get from across the room. You will note the patient's sex and approximate age. Determine whether the patient has experienced a trauma event or an illness type event. These life threats are related to problems with the patient's, generally to their airway, to their breathing, and their circulation. So it's important to identify these threatening conditions quickly so you can take immediate action to correct any types of these types of conditions. So your impressions may help you determine whether the patient has experienced a trauma or an illness. The patient's position or sounds he or she is making may also indicate the nature of this problem as well. So as you address the patient, you may gain some insight into the patient's level of consciousness. Always introduce yourself. Hi, my name is Jeff. I'm the paramedic and I'm here to take care of you. Can I help you? That's asking for consent right there. And if they say, yes, please help me. Okay, well, what is your name? Their name is Tom. Well, now they know who they are. So that's a good indicator that their level of consciousness is not so bad. It's pretty good. Don't let your initial impression block out later information. So make sure we're getting this information very, very quickly. Ask them if they know person, place, time, and event. So person's their name. Place, where are you at right now, Tom? Oh, well, I'm out in the middle of the street. Okay. What time is it? Is it daytime or nighttime? Well, it's daytime. Okay, well, he knows time. Now event. What happened? What happened to you? What happened to you that someone called 911 or you called 911? Oh, well, I fell off the ladder. So see, we've gotten all that information, person, place, time, and event that establishes that level of consciousness. All right, so here it is, right what we talked about. Assess your level of responsiveness, introduce yourself. Please don't forget about that. You know, people don't want you touching them, talking to them, that kind of stuff if you haven't at least given your name and your reason for being seeing the fact you're going to be helping them and get that consent. Can I help you? Allow them for them to say, yes, please help me. So that's establishing that patient's level of consciousness. So again, even if they appears to be unconscious or semi-conscious, still introduce yourself. Hey, I'm Jeff. I'm here to help you. I'm here to help you. Hello, are you there? You know, can you hear me? Those kind of things. All right, so with that level of consciousness, we're using the AFPU scale. AFPU means alert, verbal response, painful response, unresponsive. So, in performing a rapid exam, we're going to assess the airway first because, again, we're still in primary assessment. So, if the patient is alert and able to answer questions, the airway is open. Da-da-da-da. We're good. In an unconscious patient, you must open the airway yourself. Remember we talked about this in airway, head tilt, chin lift maneuver, that kind of stuff. You got to open the airway. Just lift jaw thrust, whatever we need to do. Open the airway to see if they breathe. Also look inside their mouth for any foreign bodies or any kind of secretions. And make sure you're clearing the airway as needed. There could be chewing gum in their mouth. You just never know. And then you may need to insert an airway device. So we'll make that decision once we move along the scale here. All right, so assess for breathing, rate and quality. Rate and quality. Breathing, so we're doing the ABCs, okay? And this patient here, it looks like this patient may be unconscious. Unconscious patient, we use CAB. We check for a pulse first, and then we open the airway. If they have a pulse, and hopefully after that they breathe. If the patient is unconscious, use the look, listen, and feel approach. That's what she's doing. She's looking at his chest, okay? You can see that line of sight there. She's looking at his chest. She's listening for any airflow, and she's also feeling for it as well. All right, so check for any foreign body objects that's in the mouth and remove them. If the patient is not breathing, you're going to have to start performing rescue breathing for them. All right, so circulation. Now we're in the C. Okay, circulation. If the patient is unconscious, check for a carotid pulse. And once again, we're looking for rate and quality. If the patient is conscious, assess the radial pulse. Again, rate and quality. Check the patient for any severe external bleeding. We need to stop that bleeding right away. If we see any bleeding, we got to stop what we're doing and do it ourselves or assign somebody to that. If you have two of you, assign somebody. Say, fix it, stop the bleed, and let that person stop the bleed. Assess the patient's skin color and their temperature. That gives you an idea of how good their circulation really is. All right, so here you are, checking for a carotid pulse. Okay, here he is. He's checking for his carotid. And then here, radial. Remember, I said that the thumb side is where the radius is. This is the radius bone that's in the arm, in the lower upper extremity, lower portion. It is, remember, it's the part that allows you to turn your hand. That's why we call it the radius. That's why it's called the radial pulse. All right, continue on with your rapid exam. Description of skin color. Is it pale? Is it flushed? Is it blue? Is it yellow? Is it normal? These are all indications of different things. If it's pale or whitish, it can be decreased circulation. If it's flushed or red, it could be excess circulation. Otherwise, maybe they're overheated. If they're blue, that's always bad. Blue is not a good color. So that means that they have a lack of oxygen. There's probably an airway problem. And yellow, that could be some kind of liver problem. So, and then normal is nice and pink. Okay, they should be a normal color. So hopefully your patients are a normal color. All right, so update any responding EMS units. Now remember, you've dialed 911 or called 911, you've gotten some other people. You need to update them on what's going on. Here's some of the stuff that you should tell them. Age and sex of the patient, chief complaint, their level of responsiveness, and their status of their airway, breathing, and circulation. Try to perform all 4 steps of the primary assessment as quickly as you make contact with the patient. In EMS, as an EMT, we train people that this primary assessment needs to be done in 90 seconds or less. Okay, so 90 seconds or less. History taking. Now remember, this is the next part. We're on part 3. First part, scene safety, scene size up. Second part, primary assessment. Now we're in history taking. History taking is when we put on our little detective hat and we start looking at things. We want to find out what's wrong with the patient. We'll start gathering the history, the information. So don't allow conscious patient's comments necessarily to distract you. It's very, very important to acknowledge the patient's primary or chief complaint and provide them reassurance, but you got to keep moving, okay? Don't let them distract you from getting this assessment done. It's very important. The 3 purposes of obtaining a medical history is as follows. It's to gather a systematic account of the patient's past medical conditions, illnesses, and injuries. All right, the next one is to determine the events leading up to the present medical situation, and also to determine the signs and symptoms of the current condition. So, questions. We got lots to ask, okay? Make sure that the questions are clear and in a systematic manner to gain as much information as possible. Learn the relevant facts about the patient's past medical history. Serious injuries in the past, illnesses, or surgeries, real important. Prescription medications, over-the-counter medications, to also include any herbal medications they may take. Are they allergic to any medicines, foods, or do they have any seasonal allergies? These are all important things to ask. Also, we use the acronym SAMPLE. Signs and symptoms, allergies, medications, past medical history, last meal, and events leading prior to. This is the framework that we utilize. It gives us a whole good status to ask a lot more questions. So ask the patient one question at a time, each one of these, okay? Listen carefully and use good eye contact. If the patient is unconscious or senile, a family member may be the best person to get that information, or the caregiver. Communicate this information to other personnel when they come up on scene, because they're going to want to know this info. They'll be very proud that you have already established that relationship with the patient and you've gotten that information. Okay, there you go. Sample medical history. This is table 9-1. It is in your book. This is slide 25. It gives you all the information you need to know about sample. We have lots of acronyms that we use in emergency medicine that helps us to remember what we're supposed to do. And this is an example of one of them, sample. All right, secondary assessment. Okay, all right, we're now moving into the 4th part. The secondary assessment is done to reassess non-life-threatening conditions. Remember, the primary was life-threatening. Now the secondary is non-life-threatening conditions. This is after you've completed your primary and done your best you could to stabilize any life-threatening conditions. Vital signs are taken as a part of the secondary assessment. The physical exam helps you to locate and begin initial management based on the signs and symptoms of the illness or injury. Signs and symptoms. Again, a sign is something about the patient you can see or feel for yourself. Again, a sign is like a stop sign. It's something you can see, okay? A symptom is something the patient tells you about his or her condition. You need to be able to assess selected signs and report them systematically when you transfer the patient care over to the caregivers that you've called, with the EMS system. All right, so here's your secondary assessment. Again, remember I told you about these acronyms that we like to use. The mnemonics that we like to use. Here's table 9-2 and 9-3. For signs of injuries, we can use dots, deformities, open injuries, tenderness, and swelling. For DCAT BTLS, we can also use that as well for injuries, deformities, contusions, abrasions, punctures, or penetrations, burns, tenderness, lacerations, or swelling. You can use either one of these, dots or DCAT BTLS. All right, so continue on with the secondary assessment. You need to conduct a thorough hands-on full body assessment in a logical head-to-toe systematic manner. Use clear and concise formats to communicate your findings to other medical personnel. The full body assessment can be done whether the patient is conscious or unconscious. Assume that all unconscious injured patients have spinal injuries, and therefore you want to protect the spine until someone takes over. All right, so stabilize the head and spine to minimize the movement during the patient examination. Immobilize all injured unconscious patients on a backboard or some kind of device like a scoop stretcher, whatever the case may have, whatever you may have as a first responder in your department. Follow the steps in skill drill 9-1 to perform the full body assessment. You're going to start with the head, then move to the eyes, nose, mouth, the neck, the face, the chest, the abdomen, the pelvis, the back, the extremities. Okay, so that's a very simple rundown on what you're going to do. You're going to start from head and go to toe. Okay, very simple, very simple stuff. All right, so examining of a specific area of the body. An exam of a specific area of the body is generally performed on patients who have sustained a non-significant mechanism of injuries and on responsive medical patients. The type of examination is based on their chief complaint. My arm hurts. That's all. I fell, I did not pass out, I tripped, and my arm hurts. So you're going to focus on the arm. That goal of the exam is of that specific area of the body is to focus your attention on the immediate problem. This is one of the reasons we call it a focused exam. All right, next, vital signs, respirations and pulse. Okay, first off, rate and quality. I always tell people, if you just remember the rate and the quality of either one of these, respirations or pulse, you're way ahead of the game. Normal adult resting respiratory rate is somewhere between 10 to 12, 12 to 20. It all depends on their physical condition. But if you go with a normal 12 to 20 breaths per minute, you're in the ballpark. Count the patient's breath for 1 minute, okay? All right, 1 whole minute. Check the breathing rate and quality, okay? Pulse, it indicates the speed and the force of the heartbeat, okay? Take the radial pulse of all conscious patients and see, because if you have a radial pulse, you generally have a fairly decent blood pressure. So that's a good ballpark to be in. All right, so take the carotid pulse of an unconscious patient. When examining an infant, you're going to use the brachial pulse. Remember that? That's the one right here in the arm. Okay, right there. All right. In a normal adult, the resting pulse rate is somewhere between 60 and 100 beats per minute. Determine the rate and quality. The way that we check for a pulse, it's very simple. Okay, very simple. You go ahead and count the pulses. Okay, the pulse beats, the heart beats, whatever you feel in the carotid or the radial. Count it for 15 seconds and multiply it by 3. Right. So if you count 22, that gives you a heart rate of 66. Okay, so that's pretty simple. I'm sorry, 68. Now, if even simpler, if you want to make sure that you got a long enough time, count it for 30 seconds and multiply it by 2. So, again, you just need to assess that for the right period of time to make sure that we've got the right amount of beats. So, if you were counting it for 30 seconds, if you counted it for 30 seconds and you got a count of 30, you multiply that by 2, that's 60 beats. Okay, so just keep that in mind. Capillary refill is also a good way. What we do with capillary refill is that we take the finger, squeeze it, let it turn white in color, right? Then let go, and as the pink comes back, you count that in seconds. If it's less than 2 seconds that it comes back to a nice pink color, it's doing it very well. Another place to tell to do that is in the palm of the hand. Just push down and hold it, hold it, hold it, hold it, hold it, hold it, and then let go. And when that pink color comes back, that's less than 2 seconds, that's okay. All right, anything more than 2 seconds is delayed, and that may be an indicator of some kind of shock. All right, well, there it is. All right, so that's the information. Squeeze the patient's nail bed firmly between your thumb and forefinger until the nail bed looks pale. This is what we talk about. Release the pressure and count 2 seconds. A normal should be around 2 seconds. All right, so blood pressure. All right, so high blood pressure may indicate that the patient is susceptible to stroke. Low blood pressure generally indicates some kind of presence of shock. The blood pressure measurement consists of reading two numbers, which represents the pressures found in the arteries as the heart contracts and relaxes. The high number is the systolic pressure. It is the force that's exerted on the walls of the arteries as the heart contracts. The lower number, the diastolic pressure, is the arterial pressure during the relaxation phase of the heart. Normal blood pressure, okay, hypertension exists when blood pressure remains greater than 140/90 after repeated examinations over several weeks. Hypotension exists when the systolic pressure falls below 90 millimeters of mercury or less. Checking the blood pressure by palpation is an easy one to do. You get the blood pressure cuff onto the uninjured arm. Make sure it's not on an injured arm. And go ahead and wrap the cuff around the upper arm. The bottom of the cuff should be 1 to 2 above the crease of the elbow. Be sure to use the appropriate size cuff for the patient, such as a narrow cuff for a child and an extra large cuff for an obese patient. Turn the control knob on the blood pressure inflator bulb clockwise to close the valve. With fingers of your other hand, locate the radial pulse at the patient's wrist. Slowly pump up the blood pressure cuff until you can no longer feel the radial pulse. Continue to pump up the cuff for another 30 millimeters and then slowly release the pressure in the cuff. When you first feel the pulse return, note the needle on the dial. This is your systolic pressure. The palpation method does not give you a diastolic pressure. It doesn't give you the bottom number, only the top number, okay? So checking by blood pressure by auscultation is a little bit different. All you're doing is you're doing the same manner as the palpation method, but after you apply the cuff, locate the brachial artery on the medial side of the arm at the crease of the elbow. You're going to put your earpieces or your stethoscope in your ears and place that little diaphragm of the stethoscope over the site of the brachial pulse. Okay, brachial pulse. When you pump up the cuff, okay, and you can no longer hear the sign of the brachial pulse, note the pressure on the dial. Continue to inflate the cuff for another 30 millimeters and then slowly and smoothly release the air from the cuff. Carefully watch the indicator needle and listen for the pulse to return. This is the systolic pressure. As the cuff pressure continues to fall, listen for the moment when the pulse disappears. That is the diastolic pressure. Blood pressure taken by auscultation is reported as systolic pressure over diastolic pressure and is always given in even numbers. You're going to have many opportunities to take blood pressure once we get you into the skills lab. So don't be worried about everything that I just said. It's just the procedure for doing it. And we will learn that in the lab. And you'll get to practice it until you're very good at it. All right, so continue on with our secondary assessment, skin condition. Like we mentioned, skin color, temperature, normal body temperature is about 98.6. Normal skin conditions are described as warm, pink, and dry. Then we look at pupil size. Examine each eye to detect any signs of injury, stroke, or potential overdose. Assessing the pupil size, as you can see here, there's different. Look, these here are equal. As you can see, both of the pupils, and what we're talking about is this little black circle, that's your pupil. So they both look equal. Over here, they are dilated. So this is considered dilated. Those pupils are really big. And then over here, they're pinpoint. Okay, very pinpoint. So usually when they're dilated, this is some kind of stimulant drug like cocaine or meth, that kind of stuff. And then over here, when they're pinpoint, that is usually an indicator of some opioid or some kind of central nervous system depressant. So that's just some information for you to know. All right, pupil of unequal sign can indicate stroke or injury to the brain. Pupils that remain constricted is a person who's taking narcotics, like we mentioned earlier, and also alcohol too. Anything that's a CNS depressant. Dilated pupils indicate a relaxed or an unconscious state. It also would also suggest that they could be taking some kind of stimulants as well. Right, so level of responsiveness, observe and note any changes that occur between the time of arrival and the time that you turn over to the patient, and then use the APU scale. And again, that APU scale, we talked about it, it's the level of responsiveness. Signs review. Signs are the indicators of any injuries. We've talked about that. AVPU, when we talk about AVPU, are they alert, person, place, event, and time? Or do they respond appropriately to verbal commands or inappropriately to verbal commands? P, they're not responsive to any verbal commands whatsoever. So they're only responsive to painful stimuli. Is it appropriate or inappropriate? Do they grimace? Do they localize? Do they push your hand away? Or do they just have a general reaction to the pain? And then finally, unresponsive. There's no response whatsoever. All right, now we're into the final phase, okay, the final phase of our assessment, the fifth phase, which is reassessment. If you need to continue to care for the patient, it is necessary to regularly repeat some parts of the patient assessment. This is the process of reassessment. Biggest one is go back to your primary. Recheck the patient's level of responsiveness and recheck the patient's airway, breathing, and circulation. Continue to maintain an open airway and to monitor breathing and the pulse rates for their quality. Reassess their vital signs. Relook at their skin color. Reassess the patient's blood pressure. Make sure to reassess the chief complaint. Has it gotten worse or is it any better? Recheck the effectiveness of any treatment that you may have done, such as stopping bleeding, putting bandages on, putting a splint on, those kind of things. All right, so identify and treat any changes in the patient's conditions. Identify and treat the changes you have noticed in the patient's condition and then reassess the patient. Reassess a stable patient every 15 minutes. If the patient is unstable, repeat the reassessment every 5 minutes. Provide a handoff report. So now EMS has arrived. So you need to give some information to them. This is you're describing the findings concisely and accurately to the EMS personnel who take over the care of your patients. This is a handoff report. So you need to provide all this. Age and sex of the patient, history of the incident itself, patient's chief complaint, patient's level of responsiveness during while they were in your care, how you found the patient, the status of their vital signs, and any results of any secondary assessments. All right, so you also need to give pertinent medical conditions such as the sample format. You know, it's the allergies, medications, past medical history, last meal, and events leading prior to. Any interventions that were provided and how the patient responded to those interventions. All right, so a word about medical and trauma patients. Patients can generally be classified into those two categories, okay? Those who have a sudden illness, such as a heart attack, stroke, asthma, gallbladder problems, and then those who sustain trauma, such as a fall, motor vehicle crashes, or sports-related type of injuries. The patient assessment sequence can be used to examine patients who have experienced illnesses, trauma, or both. Sometimes you may have somebody who had a heart attack while they're driving down the road and then they crash into a tree. So they're having a heart attack and they've got trauma from the crash into the tree as well. So you got to keep that in mind. When examining medical patients, follow the basic sequence. Complete a scene size up, perform your primary assessment, and obtain the patient's medical history or sample. Get your secondary assessment done, then perform your reassessments as possible, as necessary. When caring for a trauma patient, modify the preceding sequence slightly. When you're performing that secondary assessment before taking the patient's medical history, do not forget to keep in mind any spinal immobilization that needs to be done. And also, you know, don't delay transferring care over to somebody or getting them to a hospital to perform a secondary on scene. That's just not that important. If the patient is really critical, they need to get to the hospital as quickly as possible. So, although it's often helpful to consider whether the patient's problem is caused by trauma or sudden illness, avoid jumping to conclusions. The most important factor to remember is to follow a system of patient assessment that will gather all of the information that you need to make good decisions. All right, so summarization. A complete patient assessment consists of 5 steps. Scene size up, primary assessment, gathering the patient's medical history, perform a secondary assessment, and then provide a reassessment. The scene size up is a general overview of the incident and its surrounding. On the basis of this information, you can make decisions about the safety of the scene, the type of the incident, the mechanism of injury or illness, the number of patients, and the need for any additional resources. During the primary assessment, we need to determine and correct any life-threatening conditions. The steps of the primary assessment are to form a general impression of the patient, assess for responsiveness, and perform a rapid scan that consists of checking and correcting problems with the patient's airway, breathing, and circulation. Finally, be sure to update your responding EMS units. All right, so the purpose of obtaining a medical history is to gather a systematic account of the patient's past medical conditions, illnesses, and injuries to determine the signs and symptoms attributable to the current condition. The sample history provides a framework to ask further questions of the patient. The secondary assessment of the patient consists of secondary assessment of the entire body, used to assess non-life-threatening conditions. It is done only after completing the primary survey and our primary assessment, and also stabilizing any life-threatening conditions. This assessment helps you to locate and begin to manage the signs and symptoms of illness or injury. After completing the secondary assessment of the entire body, be sure to assess the patient's vital signs. When all patients carefully, you're watching all patients carefully for changes in their status is very, very important, because they do change. Patients, their conditions get worse. I mean, as things become more and more unstable, you need to recognize this in your patient. If the patient is stable, repeat the vital signs every 15 minutes. If the patient is unstable, repeat the vital signs every 5 minutes. If the patient condition changes, repeat the primary assessment and identify any changes in the patient's condition. Provide a concise and accurate handoff report to the EMS personnel. And generally, patients can be classified into those two categories, medical and trauma. When examining a medical patient, make sure you follow the assessment sequence of scene size up, perform a primary assessment, history taking, utilizing the sample format, doing a secondary assessment to include a head-to-toe assessment and also vital signs, and then providing an ongoing assessment. When examining trauma patients, perform the secondary assessment before obtaining the patient's medical history. All right, assessment time. You guys know what this means. Congratulations, we've gotten this lecture behind us. Going back to your JBL Navigate dashboard, go to the assessment block, open the chapter assessment for this lecture, and then complete the assessment and submit. You also may take that assessment as many times as you like. Work at it hard, get a better grade on it. Get as best grade as you can get on it. Just keep taking it over and over again. And you know that you must achieve a 70% or higher cumulatively score for each and every chapter. All right, folks. You know what to do if you have questions. Thanks for your participation in this lecture. I love it. This is good stuff. Born to be a paramedic, will be a paramedic until hopefully I'm 107. All right, so if you have any questions, obviously of me or your instructor, please email them to student@emets.net, and we'll respond to you in about 48 hours. Okay, folks, have a good one. We'll see you later.